The first thing to say is go and see somebody who is familiar with the condition. There are people who see a lot of individuals with ADHD, and there's nothing better than seeing somebody who has seen this a lot. You do not have your hip changed by a neurosurgeon, or you don't have brain surgery by an orthopedic surgeon. You go and see somebody who specialises in the condition, because familiarity is important with the symptoms. The diagnosis of ADHD is actually made by clinical interview. It's not made by scan. So the diagnosis rests upon a full clinical interview to exclude other causes of similar conditions, depression, anxiety, schizophrenia, other organic conditions. But in addition to that, there needs to be some degree of psychometric testing. Now, psychometric testing is a broad concept, and there are lots of psychometric tests which you can do which have no use in the diagnosis, have no value in establishing a diagnosis of ADHD. I quite often see people who've had a battery of tests and told that they don't have ADHD, but actually the tests don't measure for ADHD, they measure for intelligence, they measure for all sorts of other things. And there are actually three main tools that we use, and these are not particularly complicated administrative tools. There's the ASRS screening tool for ADHD, which is a simple screening measure which picks up symptoms, which gives quite a good indication of the presence of symptoms. There's a scale called the Wender-Utah Rating Scale for childhood symptomatology, which is quite useful in picking up some of the earlier symptoms, particularly if it's also filled out by perhaps a parent, because children often can't remember what they were like when they were little, and I'm seeing them as an adult. And the third test that I use is the Conners scale, which is a 66-item scale, which gives actually a diagnosis and a degree of certainty about diagnosis, which is probably the most useful tool. There are others. There's a thing called the Brown scale. I don't use that, and there are other tests as well. The important thing is clinical interview, third-person information. It's often very good to have a relative, particularly a parent or somebody who knew when the adult was a child. And also the presence of school reports can be extremely helpful. People often bring extensive school reports, and you open them up and it says daydreamer, or can't concentrate. If only they got down and handed their homework in on time, then everything would be fine. And these are very characteristic. Not everybody by any means is picked up in childhood. Maybe the more hyperactive, volatile, difficult to manage child is more easily picked up, but the quiet, daydreaming child who doesn't concentrate and who leaves everything till the last moment and misses their homework, they're often not picked up or called lazy. And sometimes these people have significant problems.